We're less than a week now away as the White House hopes to have 70% of Americans vaccinated before July 4th. State health data in Georgia shows that 38% of people are fully vaccinated, with 43% receiving at least one dose. But when will we reach herd immunity? Atlanta Bureau Chief Archit Seshadri explains from our Georgia Capitol newsroom.
Atlanta doctors say the marked decline in COVID-19 infections is because of an uptick in vaccinations and say we are much closer to herd immunity than the reported numbers.
Herd immunity has two components. One is natural immunity from those who have contracted the virus initially, and the other one is vaccine-mediated immunity after vaccination. When you look at natural immunity individuals and you combine them with those who are vaccinated, that we are very close to herd immunity right now.
Doctors say most people who've recovered from the coronavirus develop natural immunity, which isn't being tallied.
So this is up to a year later. We're seeing that individuals who had naturally acquired COVID immunity are still showing high antibody levels. Vaccinated individuals are showing antibody levels of greater than 250. So there's no doubt about how great the vaccine works in boosting our immune response.
To get a true count of herd immunity, doctors say both children and adults should be tested for antibodies because the current data only reports vaccination rates.
Vaccination rates across the South are somewhat lower than they are in other states, and that includes Georgia. We are seeing people who are vaccine hesitant, and we want to reassure them from a federal public health official that these vaccines are safe, they're effective.
It's very easy to screen those people by doing a simple blood test where we draw blood and we look at antibody levels in their bloodstream. And what I'm finding is that the cutoff level for immunity is around 1. And these patients who've had COVID in the past are showing antibody levels 25, 50 to 100, which means they are immune to COVID.
Reporting in Atlanta, Archit Seshadri, Atlanta Bureau Chief.
Doctors say everyone should be screened for antibodies, especially those who are vaccine hesitant or resistant, and the testing should be free.